Hi, this is Dr. Victoria Andarcia. Thank you for joining me again on the Healthful Roots podcast. I am super excited today because I have Dr. Gopika Dasari here on the podcast. We know each other from residency, and she has recently started her own integrative medicine company. And we're going to talk about her services, the things that she's offering. And I am so excited. So thank you so much for being on the podcast.
Yeah, thank you for having me. I'm honored to be here and really excited.
Yes. So let's start with you. Can you just tell us a little bit about yourself, what you were doing before you started this company?
Well, as you know, I'm board certified internal medicine. And after I graduated residency, I was actually working as a night doctor for the last couple years. My first year, I had like a full-time job at one hospital. And then after that, I switched to a locums job. So essentially a travel doctoring. And yeah, I had been doing that for a while. And to be honest, it really put a lot of like burden on my health. I had gained a lot of weight. I wasn't sleeping well. And no matter how much I exercised, dieted, I was not able to lose anything. And so in January of this year, I decided I'm not really doing nights anymore. And I kind of switched up my lifestyle. I'm still doing some locums work and doing some daytime shifts at different hospitals, and then I'm also working at nursing homes. And I decided to start my company. But yeah,
And what's the name of your company?
my company's Ayurveda Medical, and we're a concierge integrative medicine practice. And
Right.
yeah, and we're located in California.
Yes. And you have a lot of cool services on that. But I want to ask you what got you into integrative medicine specifically, because you probably could have done a lot of different things.
Yeah, honestly, I really felt that the thing I was noticing a lot between my patients and then even just my parents, I'm Indian, so growing up, I grew up around a lot of like natural methods of healing and Ayurvedic medicine. Um, and I noticed from my patients, my parents, that there is this huge gap in knowledge of, people felt like they had to choose either a traditional Eastern medicine, natural way of healing or go the modern medicine route. And for me, I was just like, no, you can actually use both of the things. But the reason I wanted to pursue integrative medicine is so I can really give evidence-based recommendations in regards to that.
And what do you think about that integrative medicine fellowship?
I love it so far. I feel like it's really opened my eyes and broadened my spectrum of the way I want to practice medicine. And before, I feel like a lot of the things I was concerned about in terms of natural methods of healing are okay, what is the evidence? What are the doses of these maybe herbs and supplements? How do I know it's an actual good one? How do I recommend quality products to my patients? And they've been able to answer all of that and more. And even outside of supplements and whatnot, just lifestyle techniques like breathing techniques, meditation, and that impact overall on people's health. Yeah, I love it.
Okay. All right. So I want to be nosy and ask you about your immersion week there. What was that like? Because I did the fellowship too, for anybody who's listening. So I just want to know what your experience was there.
Yeah, I honestly, it was so interesting, especially when we first get there. They had us sit in a circle, and it's all the different practitioners who are there, and you're going around and sharing like what you're doing and why you're here at this like practice. And it was so interesting to see there's practitioners of like all different types of medicine there and all different types of specialties. There was oncologists, there was rheumatologists, there's obviously internal medicine like me. There's just a huge variety, surgeons. So I thought that was great. And then in general, too, they were teaching us a lot of different, I guess, like things that I did not think about in healing. Like they had a shaman come, and the shaman had worked with ICU patients actually up at a hospital at UC Davis, and they were in this like documentary and all these things, and her patients actually really remembered the things that she was doing when they were like sedated. And it was just so fascinating to me how that type of stuff really did make an impact. It's things that I would not normally think about.
Did you experience any of the energy healing yourself there?
Yeah, I did actually. They had us doing it was kind of like Reiki.
Hmm.
So you're not even like touching each other, but they're kind of like, okay, be accepting of this energy. And you could kind of feel the warmth radiating between like yourself and the other person. And then they were saying to one of us, okay, now like shut it off. And you can actually feel that coldness happen. And it's just so interesting. I thought it was fascinating.
No, that is super cool. So thank you so much for sharing your experience with the fellowship. I do think it's interesting. I also felt like when I went there, I mean, I did a month when I was in residency and I was there, and it's like your brain, it's almost like it just short circuits. And it's like, wait, what? Because I was like, where are the studies? Where's the evidence? Where is all this? And then you go there and you experience it and you're learning this and you see like, or you hear the stories of the patients and how they've been impacted. And that's why I think it's so important. Like you said, it's not, Western medicine or like Eastern modalities. Like you can definitely blend them. And you're starting to see like Reiki for is very common in hospice units, right? I hadn't heard about the shaman, but like shamanism also. So this stuff is like slowly like integrating its way into our world.
Yeah, definitely. I feel like too, a lot of the times when I'm in the hospital and I have these patients that they have chronic pain, and all I could do is prescribe them these medications that, have so many side effects. I've always thought like, okay, what else can I offer them? And I feel like through this, I'll actually be able to hopefully offer people something different that gives them real relief and maybe gets them off of the medications that they're so dependent on now.
Yeah. And so that leads me to one of the questions that I wanted to ask you is how have your personal experiences with your health, because I know that like following you on Instagram, you're like always talking about your health journey, right? But then the integrative medicine, how is that going to shape your practice? What makes your style of practice different now?
Yeah, I think that just kind of going through my own health journey in terms of weight gain, not really prioritizing my health, to kind of switching it towards me more prioritizing that. I think with my practice, there's things that I value a lot more, and I'm trying to put that towards my patient care. So I value time. And I feel like the times that I have had the best experience with my patients is when I've actually gotten a chance to really take the time to sit down with them, dive deep into what's going on, almost as if it was one of my friends or family kind of coming to me for something that they need help on. I can really get into the nitty gritty and give them recommendations that are like tailored to them rather than just a generic recommendation. Like we've all told our patients at some point, hey, diet and exercise. But okay, if someone is working 12-hour night shifts and then having to take care of their kids and having to whatever, how are they realistically going to fit diet and exercise in? So it's more so of, okay, these are small things that you can do to that fit your lifestyle that's going to be something maintainable but still effective over time. Yeah.
Yeah, no, I agree. And sometimes I give lectures like on nutrition, and one of like my criticisms of that is when you say to someone, eat healthy and exercise, like some people have no idea what eat healthy means. And I started implementing, and it would be interesting. I'm sure you have a nutritionist, so he probably does it, but I do a 3-day food journal. And I found that even people who are like, no, I swear I eat so healthy, I eat vegetables at every meal, like you still see the nutritional gaps, right?
Yeah.
So when you say just like eat healthy, that actually doesn't mean anything.
Yeah, yeah, exactly. It's just like everyone's version of that is so different. Especially too, I've noticed, I mean, I'm Indian and I'm vegetarian, so naturally I've always had a high fiber diet because I eat a lot of vegetables and
Mhm.
cook vegetables. But a lot of my patients I've noticed, they don't do that. And so I can't just go being like, get 25 grams of fiber a day because it's going to mess up their gut. They're going to feel horrible and they're not going to stick to it. Yeah.
Yeah, exactly. And just to go on like what you do and how you tailor your services, you also have you have a nutritionist and you have a personal trainer.
Yeah.
Okay,
So
just elaborate on that.
Oh, yeah, sure. So, um, I am obesity medicine certified too. So, when creating these weight management programs, I really wanted to have it be something where my clients can get educated and incorporate these things into their life. So, even once they complete the program, they're able to maintain whatever changes and continue to progress. And so, to do that, I really wanted a multidisciplinary approach and like a whole um, I guess like a whole body, whole system approach. And for me, yeah, I'm a physician. I'm able to really assess their labs and what's going on internally. But I think in terms of nutrition and actual ways that they should be, exercising, I'm not the expert in that. So I really thought it was important to get two people that were. And I've used them personally, and they are both absolutely fantastic. I've never had experiences like I have with them, so I'm excited to bring that to people.
I think it's great, and I think some people might say, oh, like that's too much, or I don't have time for this, that, or the other. But like really, when you're talking about health and if you want to change your life and you want to feel better, I don't think that you can ignore the nutrition part and like the exercise part or the stress management side, right? Like you
Yeah.
can't get better unless you're making changes in all of these areas.
Exactly, exactly. And the thing I like about it is when I meet with these patients, I really get to kind of see, okay, how much time would you have to exercise? And we can kind of tailor these programs to you. And when I've personally worked with, so it's Coach Jay, he's our fitness coach, and then Nick is our registered dietitian and nutritionist. So when I was working with Nick, I was kind of feeling a little stressed before working with him of, okay, I'm supposed to eat this many calories, this many carbs, this much fat, this much protein. And he was like, hey, make it simple. Focus on calories and protein. He's like, I don't want you to worry about the carbs and fat right now. He's like, you shouldn't have to worry about that. Make it simple. And once I started doing pretty much what he told me to do, I started noticing changes and I was feeling good. I was never feeling starving or anything like that. And it's nice because both him and Jay, they check in so frequently that when I had an injury or I had a week where I was working several days in a row, 12-hour shifts, they were able to be like, hey, okay, let's make these adjustments this week. Let's do this adjustment. So it really made it fit my life.
Yeah, which I think it's important, right? Because that's why when you're doing integrative medicine, you're learning that like not one size fits all. So I wanted to get your thoughts on like the gaps in our traditional medicine approach as because you're doing primary care, right? Like what is the difference? If someone's like, okay, why would I work with Gopika? Like what is the difference?
Yeah, I think that the difference is like we really are making it so our patients are active participants in their health. We're not just kind of throwing stuff at them like take this med and you'll do better. We're really like, okay, let's dive deep. Let's have you do some changes, but we also give you some medications if you need it. And then kind
Mhm.
of giving them ways to deal with whatever they're dealing with and maybe even heal from what they're dealing with in terms of both acute and chronic illnesses.
Yeah. And I think that that's important. That's a conversation that I have like with my patients as well as this is the lifestyle changes that it's going to take to get to where you want. But if you're not willing to do it, like here's this medication, right? And it doesn't mean that it's like right or wrong. It's just like sometimes you got to meet people where they're at, right?
Exactly.
But I
Exactly.
think being there and being able to be like, hey, but like we'll support you along the way if you need extra help. I think that's really important. So I think that that's great. Question though, what made you start that this year?
To be honest, I felt uh, I just kind of looked at where my life was at the end of last year. Um, I was working a lot. I was doing night shift. I was making really good money, and at the end of the year, I was like, "But am I happier?" I was not happier. I was like, "Did I go into medicine for this? Is this what I wanted?" And I was like, "No." And I really had to kind of dive deep of why did I go into medicine? And it was the things I value the most are, connecting with people, being there for people when they're the most vulnerable. And that's where my passion lies. And that's really why I wanted to make this practice. And that's pretty much what motivated me to get it up and running and happened this year. Yeah.
Well, that's awesome. I'm sure it took a lot of like work in the background that people didn't really see.
Oh, yeah. A lot. Oh, yeah.
Yeah. And
I'm
I
sure
also
there's
saw
more
you,
coming.
yeah, no, there's always more. Just like I said before we started, there's always more. So just get ready and enjoy the ride. But you also started doing some aesthetics I saw on Instagram. So can you tell me a little bit about that?
Yeah, I feel like I've always been really good with procedures. And, when I first worked as a night doctor, they had me being the ICU doctor at night at the hospital. And so, I was doing some of the crazy procedures like the central lines, intubations, draining fluids from lungs and whatnot. And I stopped doing procedure like those type, but I still enjoy procedures, and I'm like, I want to do fun ones and stuff that makes me feel good, stuff that makes my clients feel good. So I did a bunch of trainings in aesthetic medicine, and yeah, I've learned a lot. So I definitely wanted to incorporate that in my practice.
All right. So what are a few things that you learned and what's your favorite for you? Because obviously it depends on your skin.
Yeah, so I would say I love microneedling. Microneedling with plasma as well are some of my favorite, just because I think a lot of people talk about like preventative Botox, which, it just works a little differently. It'll freeze your muscles, but the thing is, you're trying to address these wrinkles, which happen because of a lack of collagen. And microneedling and plasma, and even just microneedling with serums, actually addresses the root problem, which is the collagen production, and it makes your body create collagen. And that's how these celebrities look so young. It's not because of Botox. They get Botox, but really microneedling is what they're investing in.
Is that why your skin looks so amazing?
Oh, you're so sweet. Thank you. I tried.
No, I
Yours
think
is
that's
too.
oh thanks. But I do the Botox part. But no, that's awesome. And then you go to people's house. So that's how your practice works, right? You have like the option of like telemedicine, but you can also go to people's house. And I saw you uh you posted about your mom, you did one of the peels on her, and I was like, I wish I lived in California.
You need to come visit, and I got you.
Yeah, but I think that's a cool model, right? Because the telemedicine, like it offers like instant support if someone needs it sooner, and then, the in-house services.
Thank you. Yeah, I really wanted to make it feel like a premier service. And I feel like a lot of times patients, like they have trouble getting to the doctor's office, and then sometimes you have a long wait in the waiting room. And sometimes people, they get self-conscious, especially with aesthetic treatments, because after you look a little bit funny sometimes for a
Yeah.
few hours. So I feel like this way, it's kind of like you get everything in the comfort of your home. You don't really have to get up and stress. Like we come to you. So yeah.
No, I think that's amazing. Yeah, no, I'm not going to anybody's house. I will stay tell you, but I think that's great. Um, so I know you started this, and how do you pronounce it? Because I know what it is. I'm just going to butcher
Oh
it.
yeah. No, it's Ayurveda medical.
Ayurveda medical, like Ayurvedic health, kind of.
Mm-hmm. Kind of, yeah.
Okay.
It's like a play on it, yeah.
Okay. Where do you see this going in the next 5 years, or where do you hope to see it?
To be honest, I really hope that it is able to take off so it can be my full-time practice. And I see it hopefully getting, expanded to maybe other cities or other states. I also see just different services I want to add. I want to definitely be able to add like, vitamin injections and IV therapies. And I also want to be able to add maybe like specialty concierge consults because I know people have a really hard time connecting with their specialists sometimes. So I think
Mhm.
having that be a concierge option would be awesome. And I've talked to a lot of my friends who are specialists and they're definitely interested. They're just like, when you're ready, let me know. And we'll set it up. So yeah, that's the goal.
Yeah, and I mean, I think that's the way that you get like the care that you need, unfortunately, is through like these concierge services where people have more time, right? I think like the issue is lack of time, but if you have more time to talk to your cardiologist or your primary care doctor, I think things would be a little bit better, at least from the patient perspective.
Yeah, definitely. I recently had someone ask me, they're like, "Oh, how come you don't take insurance with your practice?" And I told them, I'm like, look, if I took insurance, then the insurance would automatically kind of fill up my calendar and I would be forced to see, 20, 30 people in like a short span of time. And that's not how I want to do my practice. So that's really the reason I don't.
No, and then you can't, I don't think that you can put like a price on the amount of work that it takes when you're doing this work that we do with our patients, right? Like you're spending like 30 minutes to an hour, and then you're like, the charting or whatever else needs to get done after. Like sometimes I'm spending like an hour and a half just like on one patient. And like you can't really put a price on that, right? You can't see, there's no way I could see 20 patients a day and like do my job properly.
Exactly, exactly. There's just no way. And then I feel like it's the reason I'm making this practice is so I'm not stressed and so I can provide really good care. And if I'm seeing that many patients in such a short amount of time, I'm not doing justice for either.
No, and I saw something recently. I actually went to a mastermind on Tuesday, and he was talking about how you can't give someone 100% if you're operating from a like deficiency. And I know that when I was working in the hospital full time, I was like deficient like most of the time, right? And then there were some days where I had like a short fuse with like patients or with like colleagues because I was just like, I don't have like the capacity for this right now. Like, why would you want a doctor like that?
Yeah, exactly. It's like I totally feel you. There's been so many times I'm just like, oh my God, I'm so overwhelmed. I feel like I'm getting pulled in so many different directions, and you just can't provide the type of care you want. Especially, you can't even take care of yourself. I think when I was working nights, I was only sleeping 4 or 5 hours a night. It was so bad. Like, and it was chronic. Thinking about it now, I don't know how I did that for so long.
You're running on adrenaline and your cortisol is probably messed up right now.
Oh yeah, 1,000% it is. That's why I gained so much weight, and I was not able to lose anything when I worked nights, and now I am, which is great. But yeah, I was just like, when I took my obesity medicine boards, I remember I was like, I feel personally attacked because a lot of the questions were kind of describing myself. They're like, oh, this person is working nights and they're doing such and such. How come they're not able to lose weight? Answer: nights.
I mean, someone has to do it, right? So, like, kudos for being the person who was there at night when we needed you the most. But it does take a huge toll on your health.
Yeah. Like I commend the people who do it long term. They, their bodies must have just adjusted. For me, there's just no way. I don't think I was meant to.
Now, have you gotten to the part in integrative fellowship where you choose between TCM and Ayurveda?
Yeah. Yeah. I
Okay,
think
and I know like it's off topic, but I was just like, wait, I don't want to forget to ask you, is that why you chose the name of Ayurveda Medical?
well, no, not really, but kinda. I feel like I always grew up around Ayurvedic medicine, whether I knew it at the time or not. And I'm not an Ayurvedic practice, but I feel like being South Indian, I am incorporating a lot of those different traditions in my practice. And
Hmm.
so I actually just made up the word Ayurva because I liked it and I thought it was based off of Ayurvedic medicine. My mom is learning Sanskrit though, and she told me that Ayurveda is basically like the knowledge of life. Like
Mm.
Ayur is life and then Veda is knowledge. But if you're saying Ayurva, it actually means the best. So the best life.
Oh, I
Yeah.
love that.
Yeah, and I
And
didn't
did
even
you
know
just
when
like learn that? You learned that after.
I learned it after and I was like, well, this is great because that's exactly the vibe I'm trying to go for.
I mean, I can see that. That's definitely the vibe you're trying to go for.
Thank you.
No, I do love that. Okay. Well, now that we've talked about your practice, what you're hoping for, like where you've been personally, I'd love to know what your personal health non-negotiables are.
Well, definitely getting at least 7 hours of sleep. Like, I will plan my life around my sleep now. I have to get ideally 8 hours, but at least seven. That's a non-negotiable for me for sure. Um, and then honestly, that's my main one.
I'm sure after working nights, that's like definitely the main one.
Yeah.
Uh, okay. And then are there any health practices or routines that you're currently trying to incorporate?
Yes. So I'm definitely trying to incorporate meditation more. I have that app. It's called Insight Timer and it's
Oh,
free. I love it because it's just quick guided meditations. You can pick the length that you want. So I'm definitely trying to incorporate that more, incorporating gratitude practices and journaling. Yeah.
journaling has been tough for me. That's not, I've like, I wish I could get into it, but I can't. I can't do it.
Yeah, it's hard. I'm just like and also my handwriting's so messy, doctor. Like I don't even know what I wrote at the time. But
Yeah, I mean it's a great one, and I encourage patients. I think that that's the thing. Everything is different, and you go through seasons. You know, I used to be like an avid like meditator, loved it, and like now like I feel like my life is a little bit more stressful. So like sitting down to meditate has been a little bit harder.
yeah.
So I recently got into yoga,
Oh, I
loving
love
it.
that.
Yeah, and
Yeah.
that's like been like really good, and I'm like trying to get back into it. But I feel like integrative medicine is going to open like a portal for you. I recently got Reiki 1 certified.
Oh,
Yeah.
nice.
Yeah, just because like I was like interested and I had someone on the podcast who works with patients and she's like, "Oh, like I do Reiki on my patients." I'm like, "That would be kind of cool, right? Like if you can just like
Yeah.
add these things." But so anyways, I've been doing Reiki on myself. So that's the
Have-
one that I'm trying to like incorporate.
Oh, that's awesome. Have you noticed a difference?
You know, I'm gonna say that I'm a little less tired because I've been like my energy levels this year was like crazy, right? Like I worked a lot, I got married, planning a wedding. You know, the wedding was fun, but planning a wedding sucks.
Oh, yeah.
So when I was done with that, I was like depleted, and I'm like, okay, no, how do I get back? But I've been sleeping a lot and like just listening to my body, exercising a little bit less, and then doing the Reiki, which helped. So my energy levels are a lot better.
Oh, that's awesome. Yeah, I
Uh,
definitely have to look into that. My mom was certified in Reiki like years ago, growing up. So I remember her doing it and being like, "Oh, feel my hand. What do you feel?" And I'm like, "That's warm. What did you do? Like rub them together?" And she's like, "No, it's Reiki."
that's cool that your mom did that. Yeah,
Yeah.
no, it's interesting. And we're gonna do the my sister and I are into that together. So, definitely when you're ready, I know you have a lot on your hands currently.
Yeah.
Yeah, but huh?
Oh, I wanted to say real quick, like, thank you, by the way, for all your help that you've given me. Like, over the last year, I feel like I've really been able to reach out to you, and you've been so open with helping me and guiding me when I've been setting up my practice. Like, it really meant the world. And I really look up to you, and I love what you're doing with your practice. Like, keep
Thank you
doing what
so
you're doing.
much. No, I
Yeah.
loved it. I don't know when I saw that you like started your thing, I was so excited. I am so proud of you.
Thank you.
Because I think that like people who are brave enough to like break the mold and do this, especially in the medical field, it is so needed. So I really am so excited. And I'm just gonna like I even told David, I told Walbert, I was like, I'm so proud of Gopika
Oh,
because I think that it's like it's really hard. It's really hard to like the easiest thing would be just to stay in the hospital. And so I think that you're like so brave and I'm so inspired by you as well.
thank you so much. That means the world, honestly.
Yeah, and I'm happy. Anytime that you need anything, I'm here. But for our listeners who might want to get in on the action,
Yes.
how can they reach out to you or learn more about your practice?
Yes, so you can visit our website. It's ayurvamedical.com. That's AYURVA medical.com. Or you can go on our socials. The handles are all Ayurva Medical. And yeah, and you could send us an email, a DM. We have a phone number too. And yeah, definitely be able to
I'll,
help.
I'll get that all from you and it'll be in the show notes. I really want to thank you again, and I can't wait to see your business grow and flourish. And I'm wishing you all the success in the world.
Thank you so much. I really, really appreciate it.